All right, everybody. So for today, we are going to be talking about deep tendon reflexes. So what I'm going to be focusing on, I'm going to be focusing on the spinal nerve as well as what you should be expecting, especially when you are trying to elicit the reflexes. All right, so we are going to nice and break it down. Again, let's talk about the brachia. We're going to talk about brachia radialis. Or brachioradialis. Talking about the patella. Talking about the plantar. Talking about the Achilles. All right, so the first thing we're going to talk about, I'm going to teach you the best way to remember those spinal nerves. Very, very easy. Just know, the first one, anytime we're talking about the biceps or the brachioradialis, let me change it up. Instead of doing the brachia, let's just do bicep. We can't forget the tricep. All right, we do the bicep, we're doing the brachioradialis, we're doing the patella, we're doing the plantar, we're doing the what? Achilles. Are you ready? Let's do this. All right, so whenever we're talking about the bicep, think about C5, starting from C5. If you know starting from C5, then that will make your life easier. All right, when we're talking about bicep is right here. We're going to walk through it, but I just want you to remember the spinal nerves. Bicep is closer to the what? To the cervical, right? So now for bicep is going to be C5 to C6. Make sense so far? Brachioradialis start with B. As brachia in it, we are located in the hand. What does that tell you? It is going to be the same, C5 to C6. We still on that hand right here. Let's jump some step. Let's go to the tricep. Right here, this is the bicep. The back, this is the tricep right here. Tricep muscle. So that means it's going to be the continuation of your what? Bicep, which will be what? C7 to C8. Hope that makes sense. All right, so now let's go to patella. How many knee do you have? You have 2 knee. And patella is closer to the what? The lumbar. So now you got 2 knee. So that means patella start from L2. We double that one up. 2L4. Hope that's still making sense. Now when we go to plantar, plantar is what? Underneath your feet, underneath. Hope you can see my feet under. So then plantar start with P, which will be the end of that L4. So that will be L4 to sacrum. Because patella, when we're talking about the lumbar spine, go to what? L5. Then you start with the sacrum. So this one will go to S2. Now when you're talking about the Achilles, think about the Achilles right here. At the back of your heel or the back of your ankle. Right there at the back. So that would be what? Different. Closer to the patella, the plantar. So it's going to be L5 to S2. I wish I can move tricep right here. But we just gonna leave it right there. So best way to remember this, if I'm talking about the bicep, C5, C6, talking about the bicep radialis, it's also going to be C5, C6. When I go back to the tricep, we still are around the cervical area. That will be what? C7, C8. When I'm talking about the patella, right here, you only got 2 knees. Just double that knee up, right? Especially when we're talking about animal like goats, sheep. They got 4 knees. Woo! So you got 2 knees close to the lumbar. That would be what? L2 to L4. And plantar also start with P. So it's like L4, the end of your patella. L4 to what? S2. Your Achilles right there is different. Similar to the bicep, right? Because it's 5. That's when we go L5 to S2. Hope that makes sense. All right. So this is just understanding the spine. So now let's understand what would you elicit when you're trying to look for the bicep tendon reflex. So now when we're talking about the bicep tendon reflex, look at my gun right here. So now when you think right here, you can feel the tendon, the bicep tendon, which is just right here on the inside. So the main thing is I'm telling those individuals to nice and bring their hand up. Then I'm looking for the tendon right here. So now what I'm going to do, I'm going to place my hand on the outside, right here. So now I'm going to be striking my tongue. So now when you strike the tip of my tongue, look at the tip of my tongue. You can see my hand. If I strike the tip of my tongue, you want them to be nice and relaxed, like their hand is like dead. So now what you should expect is what? Flexion of the forearm. That will be the tendon reflexes for the bicep. Hope that makes sense. So you are looking for what? Flexion of the forearm. When we're talking about the biceps radialis, so think about where your radius artery is located. So then more towards the top on the surface right here, this will be where you have your tendon, your brachialis. So now what are you going to do? You just nice and get your reflex armor and just strike directly to that reflexes, to that tendon muscle right here. So now you should expect what? Flexion of the forearm as well as upward supination of the hand, right? So that means my hand is right. If I strike this, I should nice and feel more of a supination, upward supination of that of the hand. But I should also expect flexion of the hand. Hope that makes sense. So now when we're looking about the tricep tendon is located right here. So you want to support your patient's hand. Then when I strike this right here, I should expect what? An extension of the forehand. If I strike this, relax, strike, I should expect more of an extension of the forehand. So now if I transition to the patella, so here's my patella right here, I'm just nice and sitting. If I strike the patella, boom, then I should nice and feel the extension of the knee. Hope that makes sense. So now let's go to the Achilles. I'm nice and relaxing the Achilles. If I strike the Achilles, then what am I going to see? I'm going to see a plantar flexion. I'm nice and getting their leg just nice and flat. I strike the Achilles, I'm getting plantar flexion. Hope that makes sense. So now when I go to the plantar, so that means I'm drawing an upside down J. I'm trying to end towards the big toe. I'm drawing an upside down J underneath their plantar. So then what am I going to expect? I'm expecting the dorsiflexion of those toes. Dorsiflexion of those toes. But if I'm going away, if I'm drawing my upside down J and I'm going at my J end in the middle, then I'm going to nice and looking at the fanning out of those toes. Hope that makes sense. So what I want you to do, just nice and get a partner, try it out. So again, bicep, boom, flexion of the forearm. Bicep radialis, boom, flexion of the forearm, as well as the supination upward movement of the wrist or of the hand. Talking about the patella, strike the patella, boom, extension of the knee. The tricep, boom, extension of the forearm. The Achilles, I'm striking the Achilles, feet nice and flat, boom, getting that plantar flexion. Talking about the plantar underneath your feet, I'm drawing that upside down J towards the big toe. Then I should nice and see more of like a dorsiflexion of the toe. But if I go away, you can see the difference between go from the middle, drawing that upside down J, boom. But if I go right here from the top and I'm drawing that J out, then I'm going to see the fanning out. So very, very important. Hope that makes sense. Hope that was quick, very informative, and you are able to just nice and remember what to elicit during that deep tendon reflexes. All right, but before I go, let's talk about other type of reflexes. So you have the superficial reflexes or reflex. Then you also have the visceral reflex. So when we're talking about superficial reflex, that can be found on the plantar underneath your feet. Like whenever you join that upside down J, that would be more of a superficial reflexes. When we're talking about visceral, think about visceral fat. Visceral reflexes, that will happen in the stomach, especially whenever you are doing more of those what am I called? Like if you start having pain and somebody's nice and trying to do some light palpation and you're just nice and guarded, so that would be more of a visceral reflexes. All right, hope that makes sense. Hope that really helped. Thank you so much for watching. Make sure you're nice and subscribe and keep following for more. Thank you.